The Traumatic Brain Injury Center of Excellence has developed 2 fact sheets, one for medical providers and one for service members, providing important information about the effects of low-level blast exposure.
We thought that this is a great opportunity to actually put some educational information out. TBI COE has put together a provider and service member fact sheet on low-level blast, which is a way to kind of convey the important information to the communities who are impacted.
Low-level blast is any blast generated from firing heavy weapon systems or explosives in combat or training environments. It is usually associated with outgoing fire versus high-level blast, which is typically associated with combat and can be caused by something like an IED or incoming fire. It's important to note that exposure to low-level blast does not typically lead to concussion or injury. It is also important to mention that not all service members are impacted by low-level blast. Certain military occupations have been identified to be at high risk, such as artillery, combat engineers, explosive ordnance disposal, and infantry, to name a few. These occupational specialties that involve training with explosives or weapon systems have an increased risk of exposure and symptoms to include trouble concentrating, irritability, memory issues, slower thinking, difficulty hearing, headaches, and even tinnitus. So what can you do as a medical provider to help those who may have been exposed to low-level blast? First, make sure to ask service members about their job and exposures, keeping in mind that certain military occupations are at a higher risk of exposure due to the weapon systems they train with. Then document all the necessary information related to their low-level blast exposures into their electronic medical record. This documentation should include whether or not the service member belongs to a high-risk occupation and the duration of time spent training with those specific weapon systems. Finally, manage symptoms related to low-level blast exposures that do not resolve with rest. The same management processes followed after a mild TBI diagnosis may also be used for those experiencing persisting symptoms after low-level blast exposure. Additionally, the field is evolving, and the approach could change in the future as understanding of blast effects improves. We want to better understand the effects of low-level blast on long-term outcomes, on work and cognitive performance, and how secondary factors such as mental health and the environment are impacting those outcomes. With ongoing research and collaboration, we can develop better strategies to address the challenges of low-level blast exposure. For more information and additional resources, visit health.mil/TBI providers.